Hi everyone, it's Sophie, the osteopath from Perfect Balance, and I'm joined here today with my colleague.
Hi everyone, I'm Maud. I'm an osteopath at Perfect Balance in Cambridge.
Hi everyone, nice to see everyone this evening. Today we're going to talk about nerve pain, actually, the different types of nerve pain, the symptoms of nerve pain, what it may feel like, some common problems of nerve pain. And how we may go about treating nerve pain or even referrals for nerve pain. So to just start off, a lot of people suffer from nerve pain. We see nerve pain pretty much every day. It's a pretty common problem for people to have. The symptoms can vary person to person, so you may not be the textbook picture, but that's all okay. We've got lots of different tests and things that we do for it, so we can work it out. So, Maud, what are the most common sort of nerve symptoms that you see?
So mainly nerve pain, when we think about nerve being irritated, you would get some pins and needles or numbness type of pain. It's usually down your arm or your hand, or it can be down your legs and your feet. So basically, when we say nerve pain, is that one of the nerve that's coming out of your spine and then down into these areas are getting a little bit irritated or inflamed and starts to create some pain going down along its course, so along where the nerve is going down your arm. You then start feeling some different sensations. Um, so it varies in sensation, it varies in people, depending on where the nerve is irritated and on depending what part of the nerve as well is irritated. So you can get the pins and needles, but never the numbness, or shooting pain, but none of the other ones, or it can vary really. But
Mm.
the main thing would be pins and needles and numbness down these areas in your legs or in your arms.
Mm. Yeah,
Might be associated with some back or neck pain as well, depending on what's bringing on the pain.
yeah. Some people describe those classic symptoms of an electric shock or like a lightning bolt, and they go, I just do this one thing and I get this lightning bolt sensation going down my whole leg. Or I'll just be typing at my computer and all of a sudden I'll lose sensation in two of my fingers. Or I find it a bit difficult to sort of lift up the shopping. Um, it's all sometimes it can be a little bit difficult to figure out whether or not it's a nerve problem or if it's a muscular problem, but it's gets a lot clearer depending on what the patient describes it. And there's not normally sort of a clear pattern. It can be sometimes throughout the day, sometimes it's with people, it can be more in the morning, more in the evening, sometimes at night, so it can almost seem a little bit more random.
Hmm. But that's why when you come in to an osteopath, usually you get a lot of question at the beginning just to really understand the problem. We're going to ask exactly how it started, when you're getting it, exactly when, things like that. And all of that tells us information about what's happening and also which nerve is impaired if you have one nerve that's impaired. So it's depending on where you feel all of the sensation, it's going to tell us which nerve is impaired, which area is involved into that pain and into your problem.
Because, like you say, it can either be just one small nerve that's affected, or it can be that the problem comes all the way from the spine or from the vertebra or the whole spinal column, which then affects everything. Um, so, classic things that you can get is weakness, like Maud said, numbness, tingling, pins and needles. Um, but there are a lot of tests that we do. So not only do we ask questions, we do different testing as well. So some of that can be like testing your reflexes, and like when you go to the doctor and they test your knee and your knee flicks up.
You suddenly,
And we can test the reflexes in different areas of your body, and we can test the sensation of the skin and how strong and how powerful different muscle groups are. Um, Anything else that you can say, Maud?
I think for symptoms, right, it's pretty much it. And then testing as well. We just have a broad range of testing to try and figure out what's happening. But I think now we can talk about a bit where it can happen, and maybe you can relate with some of the symptoms, or you're feeling that type of pain and you're going to think, oh, exactly, that's me, I need to get that sorted. So hopefully keep on listening and seeing if you are related to that type of pain. But first of all, I'd say upper body, if we start with that.
Yeah.
So that be pain or in the neck and down the arm, or just down the arm at some point, in the hand or in the forearms. So which one do you want to start? You can do from the neck, maybe?
Yeah, if we go from head downwards.
Head downwards, good. So yeah, so starting from the neck, basically, I think a really common one would be just problem with the spine, so itself. So the one that most people have heard of is problem with their disc. So the disc is the squishy bit in between the vertebrae, that sometimes get a bit irritated or injured and can then create inflammation or a bit of irritation on the nerve that's just coming out of your spine. And when it's up here, the nerves are going down in your arm, so it can then irritate some nerve in your hand and spine. And then there's another one with muscles on there.
Mm. Yeah, so it can be that the muscles can get so tight around the area that it physically compresses on the nerve. And so the nerve doesn't have its full capacity being able to pass through. It's almost like kind of like squeezing a hose pipe. You can see the water coming out at a sort of different pattern. And there are different structures throughout from the neck all the way down. The shoulder is an incredibly complex joint, all very, very tightly knotted together and held together with lots of ligaments and muscles. So if any of that area gets a little bit tight, what it can do is that it can just stop the nerve from flowing as nicely as it would normally.
Yeah, I'd say as well, muscles coming down in the neck. Yeah, it's called like the scalenes at the front, and you have all of the branches from your neck coming down in between those sorts of different types coming all down into your ribs. So they're all going through that kind of mesh of muscles. And depending on how you're sitting, your posture, the tension within your muscles, you can sometimes just pinch a little bit on one nerve and then suddenly create that pain down the arm. So this big, scary pain down the arm can actually sometimes be very simple to treat and very straightforward. So it's not sometimes like a very scary thing, isn't it? It's just sometimes it's just a muscle that you need to release, or working on a bit of like sitting differently at work, for example. If you constantly like this, you might impinge a little bit of nerve coming down into your neck. So,
Yeah, and it's also important to mention that people begin to use their upper chest to breathe. If you ever see a baby or a child asleep, you can see their bellies coming up and down really nicely. And that's how humans were designed to breathe, using our diaphragm. But when we happen to sit down a lot, or sometimes just because we think we look better when we hold in our stomach, it makes us look a little bit slimmer. It can actually affect the muscles that are up here, because the scalenes actually make these ribs up here move. So if you're just sitting at a desk and you can't use your belly to breathe, and just that classic shoulders up and down, it can really tighten up these really quite small and delicate muscles right through here.
and I think it's worth mentioning with that upper chest breathing, it's stress as well. Is actually when people are stretched, they completely stop. Or I know sometimes when I'm stressed, I stop breathing, and you just kind of hold it, and you have this shallow breathing, which is all up here and all tension through the neck and through the front of the chest here, which then can create a lot of tension and of muscle tension and everything. So worth when you stress as well, go down your breathing and start breathing with your belly. That's going to release a lot of tension through the body as well. It's really a nice way of relaxing.
Yeah, absolutely. Some deep breaths can really affect just how you're using the muscles through here, and it's a sort of circular problem. You get a bit stressed, and then all of a sudden you have a pain, and so it makes you more stressed, and then you have even more pain, and you get tingling fingers, and you get even more tense, and then it just gets slowly worse and worse and worse. And it's quite easy for you to get a bit worried about that, a bit stressed about that, because you go, oh no, I've got this horrible injury, because everyone always hears the worst case scenarios, but sometimes it can be pretty easy to treat and relieve the symptoms that people have.
Yeah. So usually if the problems comes up here, I think like with this type of pain, of symptoms, and it's getting stuck or irritated in between the muscles at the front of the chest and just at the front of the neck. That's usually most of the time going on these fingers, usually little fingers, and then fourth fingers getting a little bit affected. So if you feel any symptoms through those areas, that might be something that you want to think about. See someone to help you with your neck or the front of your chest here, of tension through your shoulder and your neck, or sometimes as well in just at the inside of your elbow. That's another one for the funny bone here,
Yeah,
when you can actually
it's
press it, and I can already feel a little bit of tingling through
yeah.
there when you're pressing.
Yeah, quite interestingly, this is one of the only nerves that you can physically touch just through the skin. So
It's
obviously, I wouldn't.
so, yeah, it's
Yeah,
so superficial. It's right there, and you can just like
yeah,
reach the
that's
vein.
exactly. So when you bang your funny bone, that's because you physically irritated the nerve. It's really unusual, and I would not suggest that anyone go playing into their
Don't
elbow to
climb.
have a feel, because it is not a comfortable sensation. But that can be one of the reasons that you're getting that sensation through your forearm, or when you just bang your funny bone, it's because it's on that nerve just there.
Yeah, so right in there. And then the other place where you can get this type of symptoms like pins and needles and numbness and things like that, that would be more in those three fingers. So
Mm,
roughly in those three fingers. And that's one of the main one, actually, the ones that's quite well known. It's carpal tunnel syndrome.
yeah.
So that's tension through the front of the wrist here,
Mm,
which will impinge and irritate one of the nerve that's coming up into your hand and going into those three fingers. So
yeah.
people really commonly get pins and needles, numbness or pain, achiness through those fingers right in here.
Yeah, and there's a variety of reasons why people can get carpal tunnel. Some people are just more susceptible to getting it than others. It's not something that you can sort of pinpoint that you will necessarily get later on in life, but it's very common. People who are pregnant, women who are pregnant, often experience carpal tunnel because they're getting a lot of swelling through all of their joints. Um, and there are a few things that even we can do to merely relieve the symptoms, because some people get quite worried that when they've got carpal tunnel, they're going to have to wear a whole arm brace or have surgery or things like that. But these are really last resort kind of
Mm.
treatments.
Yeah, definitely. There's lots that we can do, for example, to try and relieve a bit of the tension through that tight space here. And then sometimes it's not only there, it's high up a little bit in your arm. So yeah, it's really about getting it checked out, see what's the best course of action we can give you or someone can give you. And usually it's starting with the easy and simple. And then that can sometimes make a huge difference between going to the extreme things like surgery or like anything a bit more extreme. So yeah, there's lots of things that we can try and help you with.
Yeah, definitely. And if you do have nerve pain, it's obviously a little bit concerning, but don't always presume the worst. It can
Yeah.
merely be that you're just a little bit tight. That's all.
Just a bit tight in the neck.
Just
And
a bit tight.
I
uh,
think one last thing is like as well looking bilaterally, because some people get it on both sides, aren't they?
yeah,
Um, what I'd probably say to that, I don't know what you think. I'd probably say that that might be something that you want to check out a little bit more quickly. So going after both sides, it just means that where it's irritated, if it's in the neck, it's pressing on both sides at the same times, and then it might press on other parts of the spinal cord. So that's where you just want to make sure that it's all good. So just make sure to get it checked out if it's on both sides of your hands or your feet, to try and get anything, if it's anything else, or try to have it as soon as possible and get better.
Yeah, definitely. If it is both sides, then you would want to get a clearer picture of what's going on. It could be that you've got two completely separate issues, but it could also be something perhaps a little bit more serious that's just going on through your spine. Another
Cross
very
on both sides, couldn't it, as well? The tension is the same, so it could be that as well.
Exactly. I personally have seen a patient where they had both sides, they had a problem, but it turns out he was a semi-professional boxer. So his arms were up the whole time and he was doing a lot of pretty intense work using those shoulders and his biceps and his pectoral muscles. And it turns out that it was basically like he was just overusing this whole area, which then resulted in the nerve pain.
Tension and yeah, it's interesting. That's true. Yeah, nice.
Yes. So again, it's not always the worst case scenario. Um, Anything else you want to add to that?
I think that's good for upper extremity. I think we talked about the main ones, aren't we? And so gives you a little bit of an idea of what can happen. But if you want to know more or have any more advice, just comment down below and then we can get back to you and we can see you in clinics or even online if you're not comfortable yet to get in clinic, to try and give you some advice and get you better as soon as possible.
Definitely, definitely.
So what about lower extremities now? I think lower extremities is the big
Right.
one, isn't it? It's
Yeah.
like we see a lot of lower extremity, and we're going to talk about one word that everyone's talking about as well with
Everyone knows that word. Everyone says that word. A lot of people that have low back pain come in and they say, "Oh, I've got this. I've got this. I've Googled and I've got this."
So what is it, Sophie?
That is sciatica. The big
Sciatica.
S, the big sciatica, the big problem that everyone seems to have.
And
Which
it's a big one, and a lot of people do have it. A
a
lot
lot
of
of people
people.
do have it, but I'll be honest, the majority of the people that have come in to see me, it's actually something else. Sciatica is a very specific problem, and it's not sort of that umbrella term that just covers a lot of different things. Sciatica is quite a specific problem that can be quite a difficult problem for people who do have it.
Yeah, so people use sciatica as a word for just pain going down the leg, which is pain going down the leg, but you can have pain going down the leg for many other reasons that sciatica, because sciatica basically means irritation of the sciatic nerve, which is one specific nerve coming out of your lower back. So that's in your lower back in the leg. So that's coming out of your lower back. So it's only one specific thing, but you can have other nerve in your back, in your lower back, creating also pain down the leg, but not being the sciatic nerve, so
Yeah.
not being sciatica. So that's basically the difference between what we talk as like clinicians and then what people talk about when they say sciatica.
Yeah, yeah. So if you consider how many different vertebrae are in the lumbar spine, and then you consider there's a nerve coming off each one of those vertebrae, that's a sciatic nerve. It's only one of those. So you can have problems at different levels that cause very similar things, or there's a very, very common muscular problem which causes very similar symptoms to sciatica.
Yeah.
And yeah, and that's in the piriformis muscle, which not a lot of people have heard of. And if you say that to a lot of patients, they just say, "What's that?
Where is that?
Where is that?" Yeah. So very common symptoms of sciatica is getting that pain in your lower back that then radiates down your leg. It can go to different areas of your leg. For some people, it just stays in their buttock gluteal region. Some people, it goes all the way down their thigh. Other people, it goes through the knee. And some people, it goes straight down into their toes, from their lower back all the way down into their toes. Now, piriformis, that muscle is in your buttock. Now, that can present very similar symptoms because the sciatic nerve physically passes through the piriformis. And so when the piriformis gets really, really tight, it actually just compresses on the sciatic nerve, which then, like we said before, causes that kind of hose pipe-like symptoms of not all of the information, all of the sensation can pass through as nicely and normally as it would.
Yeah, so usually with the sciatic nerve, you would get that type of aches and pains right at the back of your leg. So that's like common areas. And then if you look at different levels, so on your lumbar spine, different areas that gets irritated, you then start getting some pains or pins and needles or numbness in other areas. So you then start to get at this on the side of your leg, so on the inside, on the outside, or the front as well of your thigh, in different toes, in different areas of your foot. So that's how we try and pinpoint exactly if it's coming from the sciatic nerve or any other nerve. So reminding all of that is very different in everybody. So we're not made exactly the same. So it's always going to be a bit of like overall there's a problem in this area. But we can pretty much like pretty well differentiate between if it's sciatic nerve from starting at the spine level or starting in that muscle, like we said, the piriformis. That's quite easy to differentiate between both. And we can treat both. So if it's coming from your spine, so from a disc, for example, or from anything else that's happening in your spine, it can be a bit of degeneration, it can be a bit of bone spur or anything like that. It's easier to do a bit of like the piriformis, it'll go a bit faster than the spine, that's what I mean. But some people have reacted really well with treatment of the lower back, haven't they?
Yeah, definitely. There's a multitude of reasons why people get lower back pain. Like Maud said, you can get bone spurs, you can get a bit of irritation of that disc, you can even just get general wear and tear. You've lived your life, you're in your 60s, in your youth you played a bit of football, you played a bit of rugby, you've had an office job, and now your lower back is just a little bit old, and that can cause those types of symptoms and those types of problems as well.
It doesn't mean that you're gonna have it for the rest of your life at all, doesn't it? It's just like it's the way you are at the moment. It's like different things that we can choose, different stretches, different exercise, different strengthening. So many things that can add up to it, and so many things that we can do to try and change that and try and make yourself feel better.
Yeah, definitely. There are some very specific testing that we can do for the lower spine, for the legs. We can test the strength of different muscles. We can, again, test those reflexes. We can test the sensation in your legs and your lower back so that we can be really specific in our diagnosis, so that we can give you the answers that you want, obviously, and we can give you a prognosis and we can give you a treatment plan. And that may not be that you need to come and see us. It may be that we need to send you off to somebody else to get a different type of treatment or to get different types of intervention.
Yeah. To get a scan or
Yeah,
to refer to the GP, anything like that. Yeah, so through the questioning, we will try and figure out what's the best course of action for you.
yeah, definitely. And hands-on treatment is normally pretty effective, actually. So obviously, when you're getting that pain that goes all the way from your back into your toes, and it's a little bit difficult for you to do all of the sports that you want to do, or it gets really irritated after you sit down for an hour, it can be really unnerving, and it can be a bit worrying for people, but that's normally a short-term problem, and we're more than capable of helping you or guiding you or even just providing you with some information that you may want to know about this problem.
Yeah, I think lower back pain and with often pain down the back or the legs is really, really common. So if you have that at the moment, you're struggling with it, don't worry, it's really common. You're not alone, and we are here to try and help you if you need some. So just give us a comment or call the clinic to try and get a little bit more advice. But I think we should talk a little bit about when we'd want to refer, probably. So when we want to refer, basically, it's when we think it's quite advanced or there's something a bit more serious happening. one of the ways that we would think that something more is happening, it might be that on our testing, so as you said, we're going to do reflex testing, sensation testing, and then muscle testing as well. If on any of those we get some not abnormal results, so for example, if you have a loss of power in one muscles or in one part of your leg, that's quite advanced. For those type of things, we'd probably want to refer you to get a scan, get an MRI, go back to a consultant, see how advanced it is, see if there's anything else happening, and see if there's anything to do to try to really free up that nerve. Because if you get some power loss, it means that that nerve is compressed quite a lot, so it's really getting irritated, and so all of the information coming down into your leg. So basically, the information is move your leg up. It's contract this muscle. So that's the information. So if that doesn't pass really well through the nerve, then you lose the power in that part of your muscle. You lose the power in your leg. So you just want to make sure that you don't lose it completely. You just want to make sure that you get anything done to try and free up that nerve as soon as possible.
Yeah, definitely. And if there is any kind of disc involvement, or if there's any other kind of involvement, anything more insidious, anything more red flaggy going on there, you and I, the patient and I, would want to know what's going on, basically. And unfortunately, we don't have X-ray vision, so sometimes we can
I would
test.
love that.
Yeah,
I would love to be able to. I think
sometimes,
yeah, but sometimes with the testing, I visualize it, so we can't exactly know, but I then visualize exactly what's happening and trying to imagine it. That we can try and be as close as we can, but for definite answer, we're sending to have an X-ray or an MRI.
Yeah, exactly. And then we can see the whole picture, we can see everything that's going on, and it might be that it's something a bit surprising that even we didn't consider. But even so, sometimes we may need to just send you to your GP to get a couple of blood tests to just make sure that you are in tip-top shape, make sure that you're not suffering from any other pathogens, or even just referring within our team, referring someone to have physio rather than osteopathy, or rehab, or going to have some ultrasound treatment, or any kind of thing like that. Even having a gait scan to make sure that you're using your feet correctly and walking correctly, because that can affect everything from below upwards, and that may help you in your recovery.
Yeah. And I think the last thing about referral would probably be that's very specific to the lower back and to any type of nerve problem in the lower back. So that'd be what we call cauda equina. So that's a problem in the nerve that's going a bit to your bowel and bladder, and they're getting a little bit irritated, and that creates some different changes into your bowel or bladder movement. And that's something that you really want to make sure that you don't have. So if you do have it, directly talking to your GP about it. And you can also have loss of sensation in your saddle anesthesia. So that's when you're kind of wiping yourself, or when you're sitting down and things like that, that you can still feel on your saddle area.
Yeah, so if you do come in to see us and you say that you've got low back pain, I don't know about you, Maud, but I normally ask every single one of my patients with low back pain, just so that I can completely cross that problem out. Yeah. So if your osteopath or your physio or anyone like this asks you, yeah, when you go to the toilet and when you wipe yourself, can you feel it? It's an extremely personal question, we understand, and it can be very sensitive and people don't really like to talk about it. But just know that it's to make sure that we can actually rule out that there's something that's quite bad, so that we can rule it out entirely to make sure we don't have it.
I think it's important to explain why you're asking those type of questions, isn't it? Because it's a bit people are like, why are you asking me about my bowel and bladder when I have low back pain? Like, why would I tell you about this? Like, this is a little bit personal, isn't it?
Yeah.
So Yeah, so it's always like I like to explain a little bit. There's nerve coming out of your back that going to these areas. You see how close it is, your back to your bowel and what's in front. It's really next to it. So nerve coming out of your spine, coming come into those organs, and so they can create some dysfunction into those organs as well. And that's what we are there to make sure that you don't have, and to make sure that it is being checked out if you do have any of these symptoms.
Yeah, because if you do have those symptoms, then we would want to address those pretty quickly. And again, the same from what we were saying with the upper back, the upper neck and upper back. If you're getting bilateral symptoms, so symptoms down your right and your left leg, that are going into your toes and affecting power and movement and sensation, then that's again something that we, again, it may not be a big problem, but it's something that we would treat quite seriously. And we would want to make sure that you get checked out and seen and have the problem addressed as soon as possible.
Yeah, so we're not here to alarm on anything, but I thought it was a good idea to talk a little bit about where are the different sites of where the nerve can be irritated, and those are the main really common sites that we see in clinic, that we are able to treat as well in clinic, and that we've seen really great results with.
Mm-hmm.
Um, and so give us a call if you need anything. Is there anything else you want to add, Sophie?
Only that lower back pain and upper back pain is our bread and butter. You know, we see it all the time, we treat it all the time, and if we will treat it with the seriousness that it deserves, and we will ask questions that are only necessary, obviously. So try to be as honest as you can with us, even if it is uncomfortable. I know that we're new faces and it can be a bit difficult to sometimes open up to someone that you've never met before. But we're if we want to refer you off to someone, it may not be a serious problem. We just want to get a clearer picture. So please don't be alarmed if we do want to refer you off to someone. But we see this all day, every day, and you get to know the symptoms and the problems quite well. And I believe, and Maud believes, that we can really help you with these issues.
Yeah, definitely. So, any other treatment thing? I think next week, what are we talking about next week? I think next week we're talking about, is it arthritis we're doing next week?
Yeah, I think it's arthritis.
Yeah, so arthritis, that's just degeneration in your body. That's overall a word for some degeneration
Yeah.
in your body. And so we're going to talk a little bit about the different areas, common areas, and how we tend to treat it and help patients with arthritis, because it's quite a scary thing to think that our body is degenerating. But
Yeah, but again,
to everyone, I already have probably, like, I do have already degeneration in the body. It's happening from a very early age, and it's a normal process, but we'll talk about that next week.
yeah, again, something that we see all the time. So if you have any questions, please write in.
Yeah, you can write it before and then we can answer them as well if you want.
Definitely.
Good. Well, it was great to speak to you, Sophie.
Great to speak to you too, Maud. I look forward to
And
next week.
thank you for everyone joining in, and we'll see you next week for another Power Hour. Bye, everyone.
Bye, everyone.